Hello and welcome to another episode of On Topic with Dr. Lisa. I am Dr. Lisa, and today we are going to have a spooky, scary mini episode. We're going to be talking about the scary parts of orthodontic treatment. There are a few, no need to worry, but it can get kind of spooky. Today I'm going to be talking about 5 scary parts of orthodontic treatment. The most common scary thing that we see is patients that don't take care of their braces properly, meaning they don't brush enough, they don't brush properly, so they can get white spot lesions on their teeth, which are the beginnings of cavities. Let's show a couple pictures. Ooh, that is nasty. So, it doesn't look good when you have braces on, but unfortunately it looks even worse after the braces are off because those white spots don't come off of your teeth. Sometimes they fade over time, but most of the time, those are permanent scars on your teeth forever and ever. And that's a scary thought. The second most scary part about braces is along the same vein as the first. If you don't brush your teeth and you don't brush your gums, you're going to get gum disease. For you, that might mean gingivitis, or worse, it could be periodontitis. Gingivitis is a reversible inflammation of your gums. It happens because bacteria and plaque, one and the same, is food plus bacteria equals plaque, it stays on your teeth for too long, and your gums, your body do not like that, so they start to recruit inflammatory cells. So your gums will bleed when you brush. They'll get puffy and red and swollen and appear to grow up and around your braces. If it's gingivitis, this inflammation is reversible. So after your oral hygiene is improved, then that swelling and redness will go back down, the bleeding will go away, and everything can go back to normal. However, if gingivitis goes on for too long, you can get a loss of the bone that's surrounding the teeth. So when that bone goes down and disappears, it disappears forever, and that process is called periodontitis, or full-blown gum disease. Unfortunately, periodontitis is irreversible, so that is super spooky. You don't want to develop this at any point, and especially not during orthodontic treatment. When removing your teeth, your body's already remodeling the bone, and you'll lose even more bone if you're having your teeth moved while you have uncontrolled gum disease. Fortunately, I will be monitoring this, and your general dentist will also be monitoring your gum health so that you should be aware of any problems that might develop. If you do develop active gum disease during treatment, we will have to stop orthodontic treatment until everything is healthy and your hygiene is under control. A more serious problem, although much more rare, is root resorption. So on your informed consent form, before you begin ortho treatment, you'll see a little box that says root resorption. During orthodontic treatment, the teeth are moving by the bone remodeling around the teeth, and the ends of the teeth also remodel. Everyone loses around 0.5 millimeter to 1 millimeter of the length of their roots during this process, and that's considered normal and to be expected. You usually can't even tell a difference on an x-ray between before and after orthodontic treatment for most patients. However, very rarely, in less than 3% of patients, that amount of resorption, or eating away of the end of the roots, can be more. A severe amount of root resorption would be considered as losing more than 1/3 of your root. So that happens in around 3% of patients. It can be a little bit less than that, it can even be more than that. And why does this happen? It's not really known exactly why it happens in some patients versus other patients. However, there are some factors that can increase your chance of having that severe root resorption. It usually happens in your upper front teeth. If you have teeth that are really sticking out and they're brought way back, and basically if it's a big movement of your teeth, it's more likely to happen. Also, if you have thin, narrow roots, it can happen more to you. If you have any of those factors, I'll let you know. However, still, it is a minimal chance that it's going to happen, and usually the risk of having that root resorption is worth the benefit of having an improved bite and straighter teeth. If that were to happen to you, it's still not a big cause for alarm, because the end of the root even if your tooth does feel a little bit looser, it's not more likely to fall out of your mouth. Unless you develop periodontitis. If the root gets shorter and the bone gets lower, then you have less bone holding in your shorter tooth, and then you can lose your tooth early. However, most people that have this root resorption that's severe can go on throughout life as long as they take care of their teeth, everything's nice and healthy, without any decreased longevity of that tooth. The fourth scary thing that can happen during orthodontic treatment is the loss of vitality of a given tooth. That means that the blood supply or the nerve supply to the tooth dies, and that tooth would need a root canal. You can know that happens by the tooth turning gray or a darker color than the rest of your teeth. When the nerve to a tooth dies because of orthodontic forces, it's usually because that tooth had some level of trauma earlier in its life. Because of the increased risk of tooth devitalization during orthodontic treatment, it's important to tell your orthodontist if you've ever had any injuries to your face or teeth as a child or as an adult, particularly if that injury has happened to a permanent tooth. That tooth will be at a higher risk of this devitalization, the loss of the blood supply and the nerve supply. However, this problem has an easy solution, which is a root canal. After the root canal, the tooth can be bleached to be made the same color as the rest of your teeth, and it doesn't have any effect on the longevity of that tooth. But again, this condition is really, really rare. Now for the fifth scary thing that can happen in orthodontic treatment. In my opinion, it's scary to go through braces, all of the effort and energy that you put into keeping your teeth clean, wearing your rubber bands, and in the end you get your retainers and then you don't wear them, or you lose them, or you stop wearing them after a couple months or a couple of years and your teeth shift back slowly a little bit to where they came from. This is a lot of wasted effort and energy and money. So in order to protect your smile, wearing your retainer is super important. If you don't wear your retainer, your teeth aren't going to be held in place for the long run, and your teeth age just like the rest of your body, and they do want to shift and they do want to crowd in general as we get older. Fortunately, the retainer is your fountain of youth, and you should take advantage of it by not losing it, keeping it in good, clean condition, and calling us if you ever have any breakage or any issues or concern before it becomes an issue that you have to go back into orthodontic treatment to correct. So, whether you're about to begin your orthodontic journey or if you're already in progress and you have questions or fears or concerns about anything, please don't hesitate to call us and to ask. I will be glad to answer any of your questions and to make ortho treatment for you not so scary. Well, that's it. Thank you everyone for watching, and have a happy and safe Halloween. Bye.